Hello, everyone. I'm Leonel August Rodriguez, the VP of Business Development for Access Medical Labs. I'd like to thank everyone for joining us on another Access Live, where we bring you insight from leading medical experts. We do ask that all questions are submitted via the Q&A, as they will be answered at the end of our lecture. So today, we have a very special individual who will be taking a deep dive into how to optimize patient outcomes in regenerative medicine. Her journey in healthcare began early and deepened through global work and ER experiences, which led her to discover the transformative potential of integrative regenerative medicine. She is a nurse practitioner with credentials from Wharton School and the University of Pennsylvania, and she is the founder of Joy Wellness Partners in San Diego and Provo, Utah. Without further ado, Carol Bender.
Thank you so much for the opportunity, Lionel, and for Access to host this presentation. We work closely with Access when doing our lab testing for these regenerative medicine patients, and we're so excited to give you a personalized window into what our pre-treatment, post-treatment, and interim process looks like in our clinic for our regenerative medicine patients. So thank you so much once again. Welcome. I will get started here. We are going to be discussing not only a general overview of the indications for regenerative medicine. For those of you that may or may not know anyone that's ever done a PRP or regenerative medicine procedure, we'll just go through some of the different types of solutions that we offer in our clinic and that are available across the globe, which are some of the options that are available out of the country are available through our clinic partner in Mexico's. And we also have other individuals that have gone international to Puerto Rico, other countries for stem cell type treatments that just aren't yet approved for treatment here in America. We talk about the types of solutions and how important it is to give our patients education, because typically they're not hearing this information from their traditional primary care doctors or their orthopedic surgeons. So we're kind of their first window into this whole world of reminding their bodies that they can heal themselves with the right tools and the right support. We tell them about what they can do, how their basic medical history or their health status can impact their treatment outcomes, and how they can make a change in that to help their investment in their regenerative treatment to be the most effective. And we also understand how important it is to manage expectations. So we'll share with you a little bit about what we tell our patients in terms of what to expect when you are getting a regenerative medicine treatment. We work with ultrasound, as you can see in the picture here, to diagnose our patients' conditions. The patient's conditions can range from anything, whether it be already diagnosed by their primary care or even undiagnosed until they come to us, because ultrasound is actually becoming the gold standard for diagnosis of many orthopedic musculoskeletal conditions. The shoulder has already been in many research studies published that ultrasound is a gold standard for diagnosis. So I'm super pumped about our ultrasound experts that work in our clinic to help our understanding of what's really causing the patient's pain. Because yes, there can be a lot of abnormalities visualized on x-rays, like arthritis, or patients will tell us all the time that I've got bone on bone. But when we see on ultrasound the joint moving in motion, and when we have actually more pixels per square inch on our ultrasound imaging, we can determine more visualization of the cartilage that might still be present in some areas or in certain levels of depth or thinning, but not absence, where we say there is potential to regenerate and regrow that cartilage. And we've seen it with one treatment, maybe two treatments, the patient's cartilage starts to regrow and their pain reduction is significant for them. So not only does regenerative medicine have potential for orthopedic conditions, from the knee to the shoulder to the ankle to the back to the neck, to head to toe, really. It can help with inflammatory conditions that are systemic, where we would give a patient an IV infusion to cool down their inflamed body and the inflammatory response of their immune system. It can be helpful for patients that have had strokes, especially if you can catch the patient in a recent post-stroke condition where there's still an acute phase going on, and the regenerative solution can be, again, anti-inflammatory and help to balance that healing process for the patient. Herniated discs have been rehydrated with regenerative medicine solutions and helped the surrounding structures to be stabilized and let that herniated disc kind of get back into position in a healthier way and in a less painful way for the patient than potentially the surgical route. So we also see a lot of aesthetic improvements from regenerative medicine. We see that regenerative medicine has the biggest potential and the quickest response when it comes to areas of the body that a lot of blood flow will go to. So the scars on the skin we know there's a lot of vasculature on the skin and the surface of the skin where we bleed a lot when we have injuries. So they are very quick to respond to regenerative medicine. And I would say one of the first experiences that gave me belief in the power of regenerative solutions was a burn victim who lost so much of his face and then had some topical application and some injections of regenerative solutions. And he was able to restore complete normalcy of both sides of his face after a few months after the treatments. So you can visually see it on aesthetic treatments, whether it be traumatic repair or even helping patients to have more of a youthful look, reducing some of the signs of aging. We love to see those positive results in our patients too. And bringing blood flow too, while diabetic neuropathy is one of those tough conditions to treat, as well as you're treating the underlying blood sugar concerns, you're also trying to help the patient's pain and their sensation to come back. So the micro nerves and the micro blood vessels can be supported with actual application of regenerative solutions around the nerves and around the blood vessels that need to support say for example, the calves and the ankles and the feet. We work with a variety of treatment options in our clinic. We give patients the choice, not only the chance to educate them or to kind of give them the options, but also to tell them, hey, these are reasons why we think one or two solutions may be better for you than another. So I think my audio is good. Placental tissue matrix is a solution that comes from a lot of our solutions do come from the donated placenta after C-section delivery to healthy tissue banks, and then they're screened and they're processed. First of all, they're chosen because they're healthy. They don't have the maternal and the infant was tested healthy before and after the birth, and it was a sterile environment to harvest the growth factors from and stem cells from these umbilical cords and placental tissue. That placental tissue matrix, as well as the secretomes, amniotic fluid, and Wharton's jelly will come from those donated tissue banks, and they're processed in a lab and then provided in little vials for us. Most of them are frozen at over -20 degrees Celsius or below -20 degrees Celsius, and then provided to our clinic and provided for use. They're not FDA approved yet, so we tell patients that they're still in research trials. Many of them are being used for post-COVID syndrome in the US. So that's kind of the FDA indication for the research trials most of the time in the US. So we make sure we disclaim that to our patients. And if patients want to use something that is more from their own body, then we work with PRP or A2M. So PRP stands for platelet-rich plasma. And many of us have heard of that. Many of us may not actually understand it as well as we could. So what the process looks like is a blood draw where the blood is spun similar to like a tiger top tube, but a way fancier processing system than that will capture a high concentration of platelets. Specifically, we use M-Site to get our highest concentration of platelets possible. And we can separate the PPP, or like the platelet poor plasma, and the PRP, platelet-rich plasma, and help that PRP to be concentrated into the most specific areas that we need to inject inside the joint. Say like the ligaments, they're so tiny, they're so small, we don't have a lot of space to inject a lot of volume. So we want it to be the most concentrated, valuable growth factors that we'll be injecting into that ligament. PRP works great for younger individuals who have great growth factors still in their platelets, but our value of our growth factors declines dramatically from birth, where we have millions and millions of growth factors per cell in our infancy, and that goes down to just hundreds by the time we're in our teenage years. And so there's a lot of a decline in potency of our growth factors in our own body, which is why we recommend patients may not necessarily choose their own bone marrow stem cell or their own platelet-rich plasma, but they may prefer to choose something that comes from the source of, the umbilical cord or the placenta or the amniotic fluid, where it's the most rapid and high concentration of growth factors available currently, because that's what stimulates the baby to grow so quickly in the mother's womb. I'm currently pregnant, so I've had experience to see how quickly I heal during times of pregnancy and how fast the baby grows, right? So you just know that that's actually happening inside the body when it's in high concentration and then re-injected into the person's body. We talk about prolozone, which is using supercharged oxygen to add that to a solution like in the picture, and then help the patient's body to get energy, like NAD production and inflammation reduction and stem cell recruitment to the area. And prolozone is a less expensive option that also is regenerative in nature. Hydrodissection is bringing blood flow back to the area and also relieving the pressure off of a nerve or off of a tendon to bring healing and restoration back to the body in that specific area. That can provide, as we'll talk about later, almost instantaneous relief when somebody's had like sciatica or a pinched nerve, carpal tunnel syndrome, just opening up that space, decompressing the nerve and releasing that nerve from where it was tethered like a spider web, or like I describe it to my patients, like you're relieving, like say somebody was stepping on your garden hose or the garden hose was kinked, and then all of a sudden you open it up and let the blood flow within the nerve and the nerve signals to fire properly. The nerve just gets so much happier and the pain can be relieved almost instantaneously. So there's many factors, as we know, that impact individuals' health, and you can understand how these factors would also impact their outcomes when it comes to regenerative treatments. So as we may, like see in our patients in San Diego and Provo, it's a lot of athletes that are already pretty healthy that are coming to seek us for regenerative treatments because they're so active, but they don't want the downtime that their surgical option would give them. They'd rather have a quicker healing, and they want to find out ways they can avoid damage or just really downtime. So they come to us looking for regenerative options. They're great candidates and they respond really well. But that's not to say that individuals with obesity, with diabetes, with a smoking history, or those that drink alcohol don't respond. It's just that we have to kind of manage their expectations and also give them the chance to work on those factors as we share with them that it does impact their outcomes and their treatments. We'll talk a lot about nutritional status and even what they can do before the treatment, like having low inflammation in their body at the time when they come for their treatment. Sometimes that means recommending to the patient that they really focus on protein and vegetables and hydration and reduce their carbs, reduce their alcohol the weekend before their treatment if they're coming in on a Monday, or just to try to work on getting their body into like an anti-inflammatory state and almost like a mild starvation ketosis state can be very beneficial for many patients for regenerative medicine outcomes. And then here we'll talk about blood markers, because that's something that we wanted to incorporate in our regenerative treatment process, that there are things that we can do both in the short term and during the healing process after the injections, and then helping the body to potentially have a more healthy state for the long term for months after the treatment. So lab work is really helpful, and we're excited that we have access again, because we can use a lot of the blood testing through access to get our patients what they need to know where they're at, what kind of treatment would be best for them. We talk about underlying conditions that we might say, okay, let's hold off on the treatment for now until we get these results more in order, or let's choose a certain treatment option that can help to hedge against some of these abnormalities before we do the treatment. We have a panel that is kind of a standard panel for us to recommend to patients that includes inflammatory markers, autoimmune conditions. It tests their hormones, also their basic, CBC, CMP to test their blood status and their organ status. We also want to check some vitamins and deficiencies that could not only impact healing, but impact their baseline health status, or maybe an example or a reason to explain some of their condition that they're going through. If somebody has like a positive ANA and they're coming to us for joint pain, we want to talk with them about their specialist care, and afterwards or during or before, they may need to do additional testing to find out what the underlying cause is for their joint pain. And sometimes it may purely be an injury or an arthritic condition, or sometimes it may be an autoimmune underlying condition that they have to work with rheumatologists for, and or work with us on regenerative solutions to help support their inflammatory autoimmune condition. Additional labs for certain individuals. Somebody has a medication that makes them more like have their blood thinned, whether they're a cardiac patient or blood clot history. We want to make sure that we test their blood factors and make sure they're stable for the treatment, for the different injections that we're doing. And if we have to do anything more, well, usually our treatments are with injections, but sometimes there's some aggressive needling that goes on, and we want to make sure that we're doing something that's safe for the patient. We check for infections, active infections, and a lot of the clinics in Mexico will ask for more advanced screening, like the STD screening for the stem cell treatments that they're going to be doing in Mexico. Also, cholesterol is a big factor in how patients going to have a response to their treatment because of the blood flow concerns that they may have limited blood flow. And cancer markers can be relevant because there have been kind of like theoretical concerns for regenerative medicine treatments to stimulate the growth of tissue. There's a theoretical concern for cancer to be propagated because of regenerative medicine treatments. This has not been proven yet. It has not been seen in reality, but it's something that we want to be aware of because of the current, cutting edge treatment that we're working with. We want to be safe with our patients, and we don't treat active cancer patients with regenerative medicine treatments. So again, we talked in general, the value of pre-testing. In a CBC, you can find out their hemoglobin status, and if they have anemia, we're going to share with them that they're going to be slower to heal and have poor healing. If their platelet counts are low, then it means that their PRP level is going to be less powerful, and we're not going to want to do PRP for that patient until they optimize their platelet count. So if they want to do PRP, we have a little nutrition plan and some in-house options for them to boost their platelet count. We also work with them and say, hey, maybe you want to choose a product from the donated placenta, for example. Infection can be a definite contraindication. If they're actively sick, we want to wait till they have a more healed body and get ready for focusing on the healing that we're going to be working and doing for them, with their body, right? CMP, liver function, kidney function, will have a big impact on healing, and we don't want to be too competitive with other sick conditions going on with the body at the time of our treatments. We want them to be very well hydrated, and we can help them with these electrolyte levels with IV infusions at the time of their treatment, before their treatment, the week before. We want to help them to get optimal hydration and be nutrient filled for response of the treatments. Fasting blood glucose helps not only for us to tell them about their potential for healing, prevention of adverse outcomes or less effective outcomes if they didn't know they had diabetes. It also gives us a clue into the longevity conversations that we have, because a lot of our patients, once they realize how effective their body is at healing itself, they start to learn they have control over their health, and they want to get into the longevity conversation. And we can share with them that statistic that in general is that every number over 89 can really take a year off your lifespan in that fasting blood glucose as like a cheap indicator of their longevity health status. We talk about hormones. We use the seed and soil analogy to share how we're planting the seeds, but your body is the soil. And if your soil is poor quality, if it's hardened, if it's lacking nutrients and fertilizer, and it has not been awakened for a while, hasn't been growing things for a while, it's not going to have as quick of a response or as powerful of a response. We want to get the soil as optimally healed, or as optimally nutrient rich and ready for the treatment as possible before we give the seeds the investment that it costs to put the treatment in. So we want the patient to make sure that they're investing at the right time in their body status. So we talk about hormones that are helpful for cell function and patient recovery. And not only are the most commonly known hormones, I think, that we talk about are testosterone and estrogen, but also they are very powerful in regenerative treatment processes. So one thing that really motivated my clinic to get started in hormone replacement therapy was actually seeing that patients with lower testosterone levels were not having as good of responses to the regenerative treatments that we were giving back 8-9 years ago when we started regenerative medicine. So using testosterone as a marker for the potential response to healing gives patients the ability to do something about it, whether they do it before the treatment or they get the testosterone replacement or testosterone supplementation, like nutrient vitamins to boost their own production of testosterone. It really will help them because as we plant the seeds, it's like giving the fertilizer as we plant the seeds. So they get the chance to fertilize and bring more blood flow, stimulate collagen production, have that optimal response from the body. Estrogen, surprisingly, has almost the same impact. In studies, you can see that it helps with tissue healing, reducing inflammation as well. So we tell our patients, both male and female, the male patients that are bodybuilders or that may have learned that they should take an estrogen blocker and suppress their estrogen levels to make their testosterone more powerful. We tell them that you actually do need some estrogen, a healthy balance of estrogen to testosterone ratio in order to have optimal healing. And for women that are in menopause, we want them to be on some testosterone estrogen balance optimization as well for reducing inflammation and helping their body to be at the healed state that it wants to be, getting their muscle strength back and getting them into a healthy response for healing. Here we have our, we'll switch here, inflammation and healing labs that we talk about. There's IGF-1 is really fun to test and show people their growth hormone kind of marker and give them the chance to be in more of that anti-aging realm by helping them to give options to boost their IGF-1, whether that be peptide therapies or other nutritional, naturopathic. There's our naturopathic doctor in the picture counseling patients on supplementation that they can do to boost their IGF-1 levels. HSCRP, we talk a lot about inflammation in general, and HSCRP is a really great way to give a patient a snapshot onto their inflammation in their body at that current state and time. And if patients are coming in from, traveling from a far way, and they need that treatment in a very immediate, acute current point in time, and they have a high level of inflammation going on at the same time, we don't want to not give them the service of their treatment. If they need that injection in their knee, we'll say, hey, why don't we also consider some anti-inflammatory things at the same time? And we talk about some of that with nutrition supplementation, but we can also do an IV infusion of those secretomes or growth factors that come from placental stem cells that will help to calm down the inflammatory state in the body in a powerful way. Those IV secretomes really go wherever blood flows. So a lot of it does go to the heart and lungs and the liver and the kidneys, but it'll also be kind of through experience that I've learned that patients will tell me that, wow, those joints, those arthritic joints, they just seem to be like not hurting anymore the day after the infusion. So it really does, the body's signals do know to call those IV growth factors to go to the right areas. Also, vitamin D, we talk about vitamin D for patients, how it does have an impact on their body's own stem cells differentiating and providing the healing that the body needs. Bone building, remodeling, wanting to prevent those patients from having future fractures, knowing after my own experience from having a fractured rib and the healing power that the regenerative solution made for my body, I never wanted to have a fracture again. So vitamin D has been optimal for me ever since. Vitamin B12 is not only useful in the actual solution, that was kind of the pink color that you saw, in our injection solutions in the photos. Vitamin B12 helps calm down the nerve pain, but it can also help with all these other factors that you see. Now, when we talk to our patients, yes, we've done the treatment. They want to know, well, how long is it going to take to work? And when am I going to see the results? So here's kind of some general guidelines of what the different treatments can take based on our experience, not 100% the same for every patient. Their response time will be faster, the healthier they are in general, and the slower but more steady healing can take time over 6 to 9 months in most cases. We look about like, half a year down the road for them to say, wow, I feel like I'm there, I've got the response that I was looking for. So when we see our patients back at 3 months for the ultrasound exam, we're not necessarily going to see a big dramatic change, but we'll start to see some subtle reductions in inflammation and some improvements in the stability at that 3-month point. But really, if you would look at it a year later, or a year and a half later, we're probably going to see some bigger changes and anatomically. So placental tissue matrix and secretomes, Wharton's jelly, the solutions that come from donated placenta and umbilical cord and birth tissue, they call it, those respond faster. They get some initial flare-up of pain, but also an improvement in say 3 to 6 months, 6 to 9 months, whereas the body's own growth factors are just going to be a little bit slower in healing. And so that can be a factor that helps patients decide which solution they're going to choose. Hydrodissection, that's one of those that releases the nerve from the pinching, and that can show an improvement in pain within a day or two. And I've seen it where a patient gets off the table and they have that the pinch or the tightness in their hip or in their low back is gone instantaneously. They're able to walk straight. Their gait is in perfect balance within like the seconds after the procedure. Maybe they had like a caught like trigger thumb or trigger finger, and that gets released with that hydrodissection. So that can be immediate response, and then it'll continue to heal as the blood flow returns to the area. A2M, I forget if I described that pretty in detail, but alpha-2 macroglobulin is what that stands for. And that's a large protein that we do have in our blood. It doesn't seem to be declining in potential effect as much as PRP as we get older. So A2M seems to be available and effective for every person in their body, no matter what age. So A2M actually blocks the MAC, the like little macrophages that are eating the cartilage in the joint that really propagate arthritis. So A2M blocks that and allows those cartilage cells to stay healthy and stop being broken down in an arthritic joint. So A2M is amazing for patients that have arthritis going on. You can give A2M first. It's not as powerful for regeneration. So then you would probably follow up with a regenerative treatment, or vice versa. You can give a regenerative treatment and then you can follow with A2M to prevent the continuation of arthritis in the joint. Prolozone, I talked about how it can be 3 sessions, a little bit less effective for unstable tears or severe injuries, but really amazing for pain reduction and inflammation and arthritis because it's stimulating healing and pretty quick in terms of the pain reduction response. Patients like to see different ways, everybody learns differently. So we give them kind of a visual example of the timeline of tissue repair and healing. And then we also break it down in kind of like words too and describe it so they can read it and learn it as they're going home. So in the first few hours after the treatment, they're going to have some increased pain, and then that can last for a couple days or up to a couple weeks after the injection, because we're basically calling the body's attention to re-heal that area. It's kind of like bringing a little bit of injury, a little bit of trauma to the area. And so we tell patients it's kind of like a post-op experience where you don't necessarily see scars on your surface of your skin, but you've had an injection of powerful growth factors, and the body's going to respond in a similar way where it's going to go and focus really hard on healing that area. So it can be pro-inflammatory by the time before it gets to be like anti-inflammatory and healing and regenerative and building new tissue. We tell patients they can take Tylenol or CBD, but they should avoid NSAIDs because NSAIDs have been shown to, in many studies, to block the inflammatory, the healing inflammation, as well as the inflammation that causes pain. We don't want to block any healing inflammation. We want patients to follow up with our treatment team and ask any questions and start physical therapy by the 2nd week after their treatment. They can continue from day 1 onwards to use nutrients that will help to optimize their healing process, whether that be vitamins, collagen, the hormone optimization that we talked about. And also they will talk about their lab results with our providers. Say they didn't get their blood work until, the day before their treatment, and they have to really do the treatment first and then do their hormone optimization. It's not like you can't, do your treatment before you have everything perfect in your body. It's just like, let's be aware, let's think about what we can do as the healing process goes on and takes, 12 to 24 months to really finish. So restoring normal activity depends on each individual, but most patients can walk around their house, and do their normal daily life things right after their treatment. Maybe we wouldn't want them to, if they got a shoulder injection, to be lifting suitcases up over their heads and going on a big airplane flight. But as long as they're not overstraining their joint, we want their joint to be in motion, and a body in motion will keep healing and keep getting blood flow to the area. So they're going to be getting back to like their full running or their full cycling or biking or swimming probably within 2 months after their treatment. Some people even do, powerful jiu-jitsu competitions like, 3 to 4 weeks after their treatment if they are professional athletes and they don't have the time to do the physical therapy and rest for that 2 to 3 month period. Again, patience is the key. Regenerative medicine procedures are delicate. We try to tape the joint not only to make the body aware, this is a healed area, this is a treated area, let's be gentle with it, let's bring blood flow to the area with rock tape, or let's put some Leuko tape on like a sprained or torn tendon to stabilize that joint and limit its motion to not re-tear it while it's healing. The pain relievers that they can use are limited and not to do anything that is going to counteract the healing process. It's really hard when you feel pain after the injections to believe in the process. And so to be reminded that it is normal is very helpful for the patient to know that expectation up front. We give them, again, a checklist with specific strategies for them about their follow-up times and the optimal timing for them to start with physical therapy. We want their physical therapy to be customized and specialized for regenerative medicine, where it's not going to be stretching the joint out of its safe range of motion when it comes to the areas that we've treated. So a lot of times that looks like keeping the elbows in when doing stretches and not going out this way and across the body, because a lot of the motions like that will actually be tearing and shearing the joint in ways that we just don't want to counteract our regenerative treatments. So we have a couple, like a YouTube video with foundation training kind of explanations. And we also recommend patients go to the website foundationtraining.com to learn from a chiropractor who did amazing work on setting up a program of functional movement coaching that can help patients from, grandparents to professional athletes to really get a rehab program in place that's healthy, that's safe, that's powerful, and can prevent future injury. There is treatments that are very effective for optimizing stem cell and PRP recruitment and healing. So hyperbaric chamber is one of them, especially when we're talking about systemic inflammation or brain injuries. But any part of the body that really needs to heal, hyperbaric chamber has been shown to be so effective. Shockwave therapy is an acoustic sound wave. That's something that can be done probably a couple weeks after the treatment, and cold laser therapy as well. We recommend naturopathic or integrative medicine, functional medicine consultations in case patients want to understand what else they can do to help their body to be optimized. And we have a list of things that they are recommended not to do after the treatment. For up to 2 weeks after, they should really be avoiding all of these things. Massage on the area or hot tub. We don't want to over circulate the blood flow away, potentially carrying the growth factors away from the area we've injected them. Same with cryotherapy. And we want them to limit their athletic activity on their injected affected joint. Sometimes patients get multiple joints done all at the same time, so they can just limit their activity all for their whole body, and then they can get back to activity at the same time. And we don't want them to stretch too much or to get chiropractic adjustments on the area that we treated. Supplementation that can be very helpful. We kind of alluded to some of this before, but peptides, we're huge fans of peptides. We've seen the way that they speed up healing, whether it be tissue repair peptides, anti-inflammatory peptides, or like, wound healing peptides. There's just so many options now that patients can learn and look at and choose from. IV infusions with vitamin C and zinc and magnesium, B vitamins can be so helpful. Giving them, whether it's vitamin shots in the clinic or vitamins to take home, turmeric, omega-3s. There's a lot out there that we recommend with the regenerative process, collagen peptides. We also recommend those powders, that they include that in their diet. And people tell us what a big difference that makes when they count their healing process from, say, one treatment to another. In conclusion, we are just so pumped that you are listening, because we believe that regenerative medicine has been incredibly, booming in the last few years, and we're at the cutting edge of it, being leaders in regenerative medicine for nearly 8 years now, and being able to share with patients that there is another option outside of surgery or outside of cortisone, because the risks and the side effects of regenerative medicine seem to be so much lower than some of the other options of traditional standard care. And who wouldn't want to foster and propagate the body's own ability to heal itself? So if you have any questions, please ask, and you can always reach out to me in the future. Here's a list of references, and we'll be happy to provide those references for you if you're interested after the presentation.
Carol, thank you so much for such an incredibly informative presentation. And you truly gave out a lot of gems to your peers who have quite a number of questions for you. And so I'll start with the first. The first question that was asked is, what is the risk of rejection issues when using PRP from a donor other than yourself?
Yeah, there would probably be some rejection issues, and PRP itself is the one that we never ever get from a donor, so we only get that from yourself. All of the other products that we get from a donor, like the placental tissue matrix or the Wharton's jelly or the umbilical cord tissue growth factor solutions from amniotic fluid, those are all immune neutral, and they don't cause any sort of rejection in the patient.
Excellent. And outside of following, the set schedule and protocol that you have set for your patients post-treatment, are there any other, ways or methods that the patients can optimize the outcomes of regenerative medicine?
Yeah, I think that we kind of covered it in our presentation. I would say there's always new things out there, so I'm happy to learn, but we've sort of curated the best practices from what we can understand in the research. But I would say we don't have all of those options in our clinic, so a lot of them we do refer out, and probably that there are things that I can learn from other providers that do a lot of the rehab expertise.
Absolutely. And on the topic of rehab, which supplements would you say, out of the ones mentioned, are the most beneficial for supporting the healing process?
Yeah, vitamin D, turmeric, omega-3s, collagen. Those are probably the top ones.
Top ones. Okay, excellent. And how do you personally manage, your patients' expectations regarding, any sort of pain flare-ups, or just a natural, and gradual healing process? Because as you mentioned, at first, it's painful, right? Like, how do you keep them, envisioning the ultimate outcome?
Yeah, that's great. I think sometimes they need their family members to hear the news too, so their family members can be a part of the explanation and the reminder. And we give our contact info to help them to understand they can come back to the clinic. We can check on it throughout the pain process. And there are actually a few things that we can do, like I mentioned, the cold laser, and that is something you could do kind of right after the treatment. So that calms down pain and dampens the inflammation. Sometimes just knowing there's like a tool you can reach for. We want patients to sleep, so we don't want them to be in so much post-procedural pain that they can't sleep, because that's so critical for healing, which I guess I should put sleep on the PowerPoint too. But the sleep process is so critical. I have given, very rarely given, an occasional narcotic pain medicine, like 2 pills, a couple days of pain relief after the treatment. But yeah, that's typically a pain that can be tolerated when knowing the benefit that can come in the long term, or knowing what they've been suffering with for a while. The pain isn't usually as bad as, say, what they've already been dealing with. Yeah. Some people
Excellent.
like it. They're like, I know something's happening. I know there's like some heat going on that's tolerable most of the time.
Absolutely. And I know individuals may use this as a method of coping with pain. I'm not sure if this is recommended or not, but what are your thoughts on alcohol consumption while under regenerative treatment?
Definitely not recommended for 3 days after the treatment. And not to say that it hasn't been done and that, it's not going to block all the results, but it's not as advised. Maybe CBD would be a better option.
Excellent. Well, Carol, truly, it's been an honor and a pleasure. And on behalf of Access Medical Lab, we truly want to thank you for such an amazing, amazing lecture on optimizing outcomes in regenerative medicine. Thank you.
Thank you so much.
It's been a pleasure. Thank you. And to our audience, thank you again for tuning in to another Access Live, where we bring you insight from leading medical experts. Don't forget to like, subscribe, stay healthy. Till next time.